These are 7 hidden carbs in low-carb foods. And the Mission Carb Balanced Tortilla is where the gap stretches widest. 2 grams of net carbs on the front of the package. The USDA FoodData Central listing for that same 42-gram tortilla shows 19 grams of total carbohydrate. That's not a measurement disagreement. That's 2 different labels for 2 different questions. And the low-carb question isn't the one the FDA wrote the rule for. So we went looking. Through the FDA labeling guide, the USDA's carbohydrate-by-difference math, the post-2023 Erythritol literature, and the ALI 2023 audit of high-protein bars. 3 loopholes kept showing up: sugar alcohol math, dextrose as a savory additive, and carbohydrate-by-difference. Today, 7 low-carb foods the data says aren't, ranked least dramatic to most. Take it for what it is. Most labeling rules answer the questions the regulator was asked to answer. The current nutrition facts label was written for the questions the FDA was asked back in the 1990s and updated in 2016: calorie counting, added sugars, saturated fat. None of those questions is the one a person eating low carb is asking the package. The closest the FDA's come to a regulatory answer for "is this low carb" is the December 2024 FDA Healthy Claim Final Rule, posted by the FDA late last year to reset which foods may carry the word healthy on the front of the package. That rule centers added sugars, saturated fat, and sodium. It doesn't establish a low-carb claim. It doesn't regulate the term net carbs. So when a package says 2 grams net carbs, that phrase is marketing. When the same package's nutrition facts panel says 19 grams total carbohydrate, that phrase is regulation. They're answering different questions. And most of us read the front of the package because the front of the package is louder. The American Diabetes Association's 2024 Standards of Care, Section 13, the Older Adults Guidance, says the practical task with adults over 65 is simplifying treatment plans to reduce hypoglycemia and treatment burden. The standards don't give label literacy instructions for low-carb eating. So part of the work here is reading the standards alongside the FDA labeling guide and the USDA's FoodData Central documentation. Across the foods most often reached for, 3 loopholes kept showing up. Hidden carbs aren't distributed evenly across diabetic-friendly food labels. The gap is structural, and 3 structures explain it. That's the kind of finding that stays, and worth sitting with for a minute. It also stopped me on the saturated fat row of the panel. Saturated fat, the dietary fat type from animal sources, is one of the 3 pillars of the new healthy claim rule, and that placement matters here. Sugar alcohol math, the FDA's rules for declaring polyols, the family of reduced calorie sweeteners, dextrose as a savory additive, a sugar by ingredient class hiding in non-sweet products, and carbohydrate-by-difference, the USDA calculation that makes total carbohydrate mean what it means. The list ranks foods by how far apart the label number sits from the measured number. The starting point was 10 candidates. The 7 kept here are the ones where peer-reviewed or USDA grade evidence carries the gap. The countdown runs from the smallest gap to the largest. And the largest gap, well, actually, let's say it plainly. The largest gap sits in the same Mission Carb Balanced Tortilla the hook opened with. We'll get to it last. Worth slowing down on when we do. Number 7. Sugar-free candies with Maltitol and Sorbitol. Picture the candy bowl on the kitchen counter, the one whose every wrapper inside it says sugar-free. The FDA's 21 CFR 101.9, the nutrition facts rule itself, defines sugar alcohols as saccharide derivatives, which is the regulatory way of saying these are carbohydrates that carry sweetness with fewer calories. The FDA Small Entity Compliance Guide spells out what's required when a product carrying sugar alcohol claims also makes claims about sugars. And the FDA's ECFR Part 101 lists erythritol, xylitol, sorbitol, and maltitol together as non-karyogenic, does not promote tooth decay, carbohydrate sweeteners, not absent ones. The arithmetic this enables on a label is small but meaningful. A candy can declare 0 grams of sugar and still declare 4 to 9 grams of total carbohydrate per serving because the sugar alcohols sit inside the total carbohydrate row. They have to. The FDC database's branded chocolate-covered candy listings show carbohydrate often at 20 to 30% of total calories, even in items the package calls sugar-free. Then there's the partial absorption problem. Maltitol, the most common reduced-calorie sweetener in mass-market sugar-free candies, gets metabolized differently from erythritol. Maltitol raises blood glucose more than erythritol does, even when both are labeled as sugar alcohols. That's the polyol gap inside the polyol category. Sorbitol behaves more like maltitol than like erythritol. Xylitol sits in between. Take that for what it is. So when sugar-free appears on a candy wrapper, it tells you a regulator-defined fact about the sugars row of the panel. It tells you very little about how the carbohydrate in your hand will move through your bloodstream. The label's silence isn't a lie, it's a different question. From candy back to the savory aisle, where this same loophole shows up in the place nobody expects. Number 6. Deli turkey and processed deli meat with dextrose. 8 grams of carbohydrate in a 6-slice serving of turkey breast isn't a number you'd pick out of a low-carb conversation. The Kretschmar Premium Turkey Breast listing in USDA FoodData Central shows dextrose in the ingredient line, declared exactly as the FDA's rules require it to be. Dextrose, a glucose sugar used as a processing aid, is technically an added sugar by ingredient class, and the FDA's added sugars labeling rule treats it as such. The halal deli oven-roasted turkey breast listing in the same FoodData Central database shows 1 gram of carbohydrate per 56-gram serving, small per serving, real over the week. The reason dextrose lands in turkey breast is processing chemistry. It carried through browning. It carried through flavor. It's a savory product ingredient that happens to be a sugar by ingredient class. The label still reads as a low-carb choice because the per-slice number sits low. Worth slowing down on, because that smallness is what kept me thinking. That smallness is what makes this loophole different from the others. With a candy, the gap is in the dozens of grams. With deli turkey, the gap sits in the ones, except a person who eats 4 slices a day, 3 days a week, is logging a gram pattern across a week that wasn't on the front of the package. The clean ingredient list that deli turkey suggests, turkey, salt, water, is rarely what the actual ingredient line on the packet says. Per slice dextrose totals fall well under 1 gram, and ingredient lists are the surer signal than the label number. Worth saying out loud because the per slice numbers are easy to wave off. What the label declares and doesn't declare here are both true at the same time. Total carbohydrate in deli turkey is small. The presence of dextrose in deli turkey is also true. Both rows of information answer different questions. And, is this low carb needs both? Which is why the ingredient line, not the label number, is where this entry actually sits. From the deli case to the freezer case, where sugar-free tries to subtract more than it can. Number 5. Sugar-free ice cream. Sugar-free ice cream is a compound case. Compared to a regular pint, the sugar-free version subtracts one specific thing, the added sucrose. Compared to what a low-carb eater is actually trying to subtract, total carbohydrate, the sugar-free version barely moves the needle. The FoodData Central Low Carbohydrate Chocolate Ice Cream Survey listing reads 2.8 grams of fiber and 3.7 grams of sugars per 3.5 fluid ounce serving, a number that sits inside a product still declaring meaningful total carbohydrate. The FDC sugar-free ice cream entries taken alongside consumer database listings show some products reaching 28 grams of total carbohydrate per cup despite the sugar-free claim. Where does that carbohydrate come from once the sucrose is gone? 3 places. The dairy itself. Milk has lactose. Lactose is a carbohydrate. The carbohydrate-by-difference math on the panel includes it. The body agents, maltodextrin and similar starch-derived ingredients commonly used to give sugar-free ice cream the mouthfeel of regular ice cream, and they read as carbohydrate. And the polyols, sugar alcohols replacing the sucrose, declared as carbohydrate per the FDA's ECFR Part 101 listing of erythritol, xylitol, sorbitol, and maltitol. This is what a compound loophole looks like. Loophole 1, sugar alcohol math, applies because the polyol substitution sits inside the total carbohydrate row. Loophole 3, carbohydrate by difference, applies because the dairy lactose and the maltodextrin get totaled by subtraction in the FDC convention. The label can read sugar-free and 28 grams of total carbohydrate at the same time, and both phrases are doing the regulatory job they were designed to do. The treat portion, a half cup before bed for someone with morning fasting glucose to manage, is where the gap registers practically. Sugar-free ice creams in consumer databases hit 28 grams of total carbohydrate per cup despite the label claim. That number stayed with me, or it should. Take it for what it is, which sets up the most measured of the lot, the bar marketed as a meal. Number 4. Protein bars and high-protein bars. In September of 2023, Ailey and colleagues published an audit in Scientific Reports. The study tested 45 samples of 9 product types: protein bars, vegan protein bars, protein puffs, peanut butter, pancake mix, Greek yogurt, whey protein, vegan protein, protein drinks, against their own nutrition labels. The protein bar finding is the one that travels. The measured carbohydrate in protein bars landed well above what the label said it would, and that's the part that stopped me when the table first came out. The exact percentages depend on which subcategory you're reading. Vegan protein bars showed a gap above 60%, and the protein bar headline figure ran higher. Measured protein in the same study came in below labeled values. Cohort scope matters here, and this is the part most pieces miss. Ailey's sample was the Egyptian retail market. U.S. Market Lab replication at the same scale hasn't been published. The FDA does occasional warning letters, Consumer Lab and LabDoor do third-party assays, but a peer-reviewed audit of U.S. protein bars at the Ailey scale isn't in the literature one could find on this pass. The mechanism the audit points at is the same mechanism every protein bar category lives with. Carbohydrate-by-difference does most of the arithmetic. Sugar-alcohol math sits inside the carbohydrate row. The marketing claim 2 grams net carbs subtracts the fiber and the polyols from total carbohydrate to produce a number the FDA doesn't formally regulate as a nutrition facts term. So the label versus measure discrepancy isn't in the panel, it's in the marketing, or in the gap between what the panel was built to measure and what the buyer is asking it. Which is to say, hidden carbs in low-carb labels are mostly a front-of-package phenomenon, not a back-of-package one. What the audit gives a low-carb eating viewer is uncommon. An actual lab number set against an actual label number, methodology peer-reviewed, sample size declared. It doesn't give them a U.S. market readout. Ailey's 2023 sample was Egyptian market. U.S. brands have not been independently lab audited at the same scale. That asymmetry is the most honest thing to say about protein bars right now. Use the audit as a mechanism proof, not as a brand-by-brand verdict. Between number 4 and number 3, the listicle is going to turn. Wait, before the turn, here's a question worth leaving between us. Of these 3 loopholes producing hidden carbs in low-carb foods, which one would you be most surprised to find in your kitchen? Sugar-alcohol math, dextrose as a savory additive, or carbohydrate-by-difference? Tell us below. Number 3. Erythritol sweetened keto snacks. In February of 2023, Witkowski and colleagues published a paper in Nature Medicine that changed how the sugar-alcohol category gets read. The study followed roughly 4,000 patients across U.S. and European cardiac evaluation cohorts and tracked their metabolomic signatures. Erythritol, the sugar alcohol most often recommended as the diabetes-friendly substitute, the one that carries the smallest glycemic effect, sat at the top of the metabolite list associated with 3-year major adverse cardiovascular events. The top quartile of circulating erythritol carried close to twice the incident event hazard of the bottom quartile, roughly twice, and that's the number that kept me thinking. Stanley Hazen at the Cleveland Clinic, the senior author, said publicly that the finding was a signal that warranted further work, not a settled causation claim. The follow-up landed in August of 2024. A controlled human volunteer study in arteriosclerosis thrombosis and vascular biology measured platelet reactivity, the activation of blood clotting cells, after ingestion of an erythritol-sweetened beverage versus a glucose-sweetened beverage. The finding: erythritol enhanced platelet reactivity in the volunteers. Glucose didn't. The Cleveland Clinic in its August 2024 newsroom note on the work, framed it as adding mechanistic evidence to the 2023 association. What the 2023 paper does and doesn't establish has been argued in the literature since publication. NIH Research Matters wrote in 2023 that further safety studies of the health risks of erythritol are warranted. Hazen, in a 2024 quote syndicated through Cleveland Clinic Media, said, "Glucose doesn't impact clotting, but erythritol does." Other researchers, including some of the experts quoted by independent science media outlets at the time of the original publication, cautioned that the 2023 dataset was observational and that confounding remained unresolved. Both characterizations are true at the same time. What this does to the listicle's thesis is what makes it the turn. The first 6 entries describe loopholes that produce label versus measured gaps without changing the food's place in the bloodstream. They're arithmetic loopholes. Erythritol isn't arithmetic. The sugar alcohol math that put erythritol in the diabetic-friendly aisle in the first place, the math that classifies it as a low glycemic sweetener, is the same math that left its cardiovascular tail unmeasured for as long as it was unmeasured. The 2023 paper and the 2024 follow-up reframe what safest sugar alcohol means. Not because erythritol's been ruled unsafe, it hasn't, but because the measurement frame that produced the safety read in the first place was incomplete. The dose pattern matters for who reads this most carefully. 3 to 5 servings of erythritol sweetened snacks per day, the dose that often appears in keto meal plan content for older adults, is the consumption frequency where the post-2023 literature is most directly relevant. The recommendation a physician would make from this evidence isn't a recommendation this video will make. The frame on offer is the same frame the cited authors offer their own readers. Here's what stays with me about that. The data signal exists. Causation remains contested. The reasonable response is to track the literature without overreading either way. Take it for what it is. The 2023 study is observational. Causation remains contested even after the 2024 platelet reactivity trial. From the loophole that grew teeth to the one that hides in plain sight on every chocolate bar shelf and stayed hidden because nobody held the brand name accountable. Number 2. Sugar-free chocolate candy. Number 2 on the countdown is the brand name loophole. The FoodData Central listing for the Zero candy bar, the brand name is the loophole, shows 37 grams of total carbohydrate per serving. The FDC low-sugar or low-calorie chocolate-covered candy category derives roughly 26% of its calories from carbohydrate. Even when individual products are marketed as low-sugar, the arithmetic is identical to the candies in Entry 7. The FDA's 21 CFR 101.9 puts the polyols in the total carbohydrate row. The branding doesn't. A product named Zero. That brand name is the loophole. The FDA's rule for no sugar-added claims is a sugar row claim. It says nothing about the total carbohydrate row. Branded Zero candy products list 37 grams of total carbohydrate per serving in FDC's branded database. That's the gap. And the number 1, a single product, a single number, a single 17-gram gap. Number 1, Low-Net-Carb Tortillas. 2 grams advertised, 19 grams measured, same 42-gram tortilla. The Mission Carb Balance soft taco listing on Mission's own product page advertises 2 grams of net carbs per tortilla. The USDA FoodData Central derived branded listing for the same 42-gram tortilla shows 19 grams of total carbohydrate and 13 grams of fiber. 3 loopholes are stacked inside that single product. Loophole 1, the polyol math that puts sugar alcohols inside total carbohydrate. Loophole 3, carbohydrate-by-difference, including the 13 grams of fiber inside total carbohydrate by USDA convention. And the marketing layer, net carbs, a phrase the FDA doesn't regulate as a nutrition facts term, subtracting fiber and polyols on the front of the package. Mission's 2 net carb claim and the FDC 19-gram total aren't contradictions. They answer different questions, which is exactly the listicle's thesis in a single product, ranked first. The label is doing the regulatory work it was designed to do. The marketing is doing the marketing work it was designed to do. The low-carb question, and the question a person buying this tortilla in 2026 is asking, is sitting in between them. Here's what stays with me. Every label number on a nutrition facts panel is the answer to a different question, and the question, "Is this low carb?" was never one of them. The three loopholes, sugar alcohol math, dextrose as a savory additive, and carbohydrate-by-difference, well, actually, that's worth saying more carefully. They aren't bugs in the labeling system at all. They're features of a system written for a different purpose. Reading a nutrition facts panel for low-carb intent is reading a document that wasn't built to answer that. The closer reading the FDA's own labeling guide and USDA FoodData Central produced side by side is this: same product, two answers, both correct, neither speaking to the question being asked. Hidden carbs in low-carb foods are, in that sense, exactly what we'd predict. A label asked one question carrying a price for the other.